first question is, how do you think things will be different post-COVID? Obviously, the things have changed. It's an interesting time in dentistry. So how do you think the things will be different in post-COVID?
Well, I think there are some basic things that nobody will argue against, and one is that price will become a bigger deal. I think we're looking at some significant increases in unemployment. And if you think about virtually every business is going to be affected, I would think. Some businesses will grow because they may be in the right market sector, but most of them won't. So I think we've sort of got to think in terms of hoping for the best but planning for the worst. And if we're really planning for the worst, I would think that if we've got massive unemployment, if the government can't support all these people who are unemployed, there's going to be a price pressure on dentistry. And given that most of the dentistry that we do these days is essentially discretionary work, in other words, the patient can live without it, that could have quite a big impact on dentistry.
Yeah,
so I mean, I can keep talking a lot on this topic, but you know, fundamentally, I think it's natural for us to think, well, hopefully things will just get better. You know, we've seen these things before, but actually, I don't think we have seen these things before. I think this is a whole new world. And in a way, it's like being thrown into a very fast-flowing stream, as if you were sort of doing whitewater rafting without the raft, and it's going to drag you down the, you know, over the cliff. So I think we have to be prepared for making some radical changes, which is something that I'm going to be talking about at the webinar that you have organised for later on.